The ongoing shortage of attention deficit hyperactivity disorder, ADHD medication, particularly Adderall, has been a pressing issue since October 2022, extending well into early 2024. This shortage has significantly impacted millions of individuals who rely on these medications to manage their daily lives. While initial reactions often point to regulatory restrictions or drug misuse as primary causes, the reality is far more complex and nuanced. To understand the true nature of this shortage, it's crucial to delve into the mechanisms of ADHD medications, the regulations surrounding them, and the changing landscape of ADHD diagnoses and treatment. Jessica McCabe from the YouTube channel How to ADHD provides valuable insights into these interconnected factors. At the core of ADHD treatment are stimulant medications like Adderall, which work by influencing two key neurotransmitters in the brain, dopamine and norepinephrine. These neurotransmitters play crucial roles in various brain functions, including reward processing, learning, memory, and movement. In individuals with ADHD, these neurotransmitter systems often function suboptimally, leading to difficulties in focus, attention, and impulse control. Stimulant medications like Adderall work by increasing the availability of dopamine and norepinephrine in the brain. They do this by slowing down the rate at which neurons reabsorb these neurotransmitters, effectively increasing their concentration in the synaptic space. For people with ADHD, when administered in the correct type and dosage, these medications can significantly improve focus, attention, and reduce hyperactivity and impulsivity. However, the effects of these medications on individuals without ADHD are markedly different. In people who do not have a deficit in these neurotransmitter systems, stimulants can induce feelings of euphoria, increased energy, and an inflated sense of cognitive prowess. This potential for inducing pleasurable sensations, combined with their impact on the brain's reward system, contributes to the addictive potential of these drugs when used inappropriately. Given these effects, it's understandable that there are concerns about the misuse of ADHD medications. Studies have attempted to quantify the extent of this misuse, with estimates suggesting that approximately 3.5 million people in the United States have misused stimulant prescriptions at some point. Moreover, around 1.5 million individuals have met the criteria for prescription stimulant use disorder in the past year. The issue of stimulant misuse is particularly prevalent among college students. Meta-analyses indicate that up to 17% of college students misuse stimulants at some point during their academic careers. The primary motivations for this misuse are often academic-related: improving concentration, extending study time, and enhancing overall academic performance. However, it's important to note that research shows that students who misuse stimulants tend to study less than their peers and often have similar or lower grade point averages. Contrary to what one might expect, the rate of stimulant misuse has not increased in tandem with the rise in prescriptions. In fact, reported misuse among young adults decreased from 5.8% in 2019 to 3.7% in 2021. This data suggests that the increase in prescriptions is largely due to legitimate use by individuals who have been newly diagnosed with ADHD. While concerns about misuse are valid and require ongoing attention, they do not fully explain the current shortage of ADHD medications. A more significant factor contributing to the shortage is the substantial increase in legitimate ADHD diagnoses, particularly among adults. Several factors have contributed to this rise in adult ADHD diagnoses. In 2013, the diagnostic criteria for ADHD were revised, broadening the definition and allowing more individuals to qualify for a diagnosis. This change reflected an evolving understanding of ADHD as a complex neurodevelopmental disorder that can manifest in various ways across different age groups and individuals. Moreover, there has been a growing awareness that ADHD is not just a childhood disorder. Research indicates that up to 90% of individuals diagnosed with ADHD as children continue to experience symptoms into adulthood. This recognition has led many adults to seek diagnoses for struggles they've experienced throughout their lives, but may have previously gone unrecognized or misattributed to other causes. The gender disparity in ADHD diagnoses is another crucial factor. Historically, ADHD has been diagnosed at a rate of 3 to 1 in males versus females during childhood. However, in adult populations, this ratio is closer to 1:1. This shift suggests that many girls and women with ADHD have been overlooked or misdiagnosed in their younger years, leading to a surge in adult diagnoses as awareness increases and diagnostic practices improve. The COVID-19 pandemic has also played a significant role in the increase of ADHD diagnoses and subsequent medication prescriptions. Between 2020 and 2021, prescriptions for stimulant medications increased by 10%, and they have nearly doubled overall since 2011. The pandemic facilitated this trend in several ways. Increased awareness. More people recognized ADHD symptoms in themselves as discussions about mental health and neurodevelopmental disorders became more prevalent on social media and other platforms during lockdowns. Telehealth accessibility. The widespread adoption of telehealth services made it easier for individuals to consult with healthcare providers about potential ADHD symptoms and seek diagnoses. Changes in daily routines. The disruptions to normal work, school, and social routines brought on by the pandemic may have exacerbated ADHD symptoms in some individuals, prompting them to seek help. While the increase in diagnoses and prescriptions is a positive development in terms of people receiving needed treatment, it has also strained the system's capacity to meet this growing demand. The pharmaceutical supply chain and regulatory framework were not prepared for such a rapid increase in legitimate prescriptions, leading to the current shortages. It's important to note that while regulations, such as FDA quotas on stimulant production, play a role in the shortage, they are not the primary cause. The FDA reports that manufacturers are currently only producing about 70% of their allowed quota, indicating that other factors are at play in the supply chain issues. As we grapple with this ongoing shortage, it's crucial to consider the broader implications and potential solutions. Policies aimed at preventing misuse of ADHD medications often inadvertently make it more difficult for those with legitimate needs to access their necessary treatments. Any solutions proposed should strike a balance between preventing misuse and ensuring access for those who rely on these medications to function effectively in their daily lives. Moving forward, several approaches could help address the ADHD medication shortage. Improving supply chain resilience. Pharmaceutical companies and regulators should work together to create more flexible production and distribution systems that can adapt to rapid changes in demand. Enhancing diagnostic practices. Continued efforts to improve ADHD diagnostic processes, especially for underdiagnosed populations like women and adults, can help create a more accurate picture of medication needs. Exploring alternative treatments. While stimulant medications are effective for many, research into non-stimulant treatments and behavioral interventions should be prioritized to diversify treatment options. Public education. Increasing awareness about ADHD, its prevalence in adults, and the importance of proper diagnosis and treatment can help reduce stigma and ensure that those who need help seek it. Policy reform. Reevaluating regulations on ADHD medications to ensure they effectively prevent misuse without creating unnecessary barriers for legitimate patients. In conclusion, the ongoing shortage of ADHD medications is a complex issue rooted in evolving understanding of the disorder, changing diagnostic practices, and unprecedented global events. As we work towards solutions, it's crucial to maintain a balanced approach that addresses concerns about misuse while prioritizing the needs of individuals who rely on these medications for their well-being and daily functioning. By understanding the multifaceted nature of this issue, we can develop more effective strategies to ensure that everyone who needs ADHD treatment can access it reliably and safely.